Today I'm particularly talking to about a young girl who's 16 years old, known as Esther Wanjiru, who has a facial deformity that has actually been able to destroy her milestone developments in life. Right now she's in the secondary school, but normally at this age she should be able to basically going into the final years of joining the university, so that they can join the university. Now, Wanjiru has been, I've seen Wanjiru for the last couple of months, and she has been seen in multiple centers for a long time. She has a condition, what we call a congenital deformity of the face that has affected the growth of certain tissues. Some are missing, some are not there. And when you look at the person, you realize that there's a discrepancy in terms of what is on one side has got a full development of the face, when the other side has what we call hypoplastic hypoplasia, where there's actually deficiency of tissue that are supposed to be there. And in this case, it's on the right side. For this particular deformity, as from her history, she recognized it when she was about 3 years old. And they say that is true because at that time, when the face is growing and the tissue are growing and they're expanding, then you realize there's a deficiency, others are not growing the way they're supposed to grow. And it has affected the eye on one side because there's no support. Okay, we've got the floor of the orbit is there, but there's the supporting, like the sarcoma bone that normally joins the orbit, the mandible, all these structures are missing that particular, the coronary are missing. And then apart from that, the soft tissues that normally feed in on your face, that sometimes you always call that you have the, in my language they say chimboto, but I would have to translate that to know what it is. That you see what shows that when you smile, the wrinkles and everything, that shows that yes, it's balanced. But in this case, when you find that because one side doesn't have the tissues, even when it is talking or trying to open the mouth, there's deviation towards one side, and the right side particularly. The nose is also affected and is, is deviated to the right side. You'll find the center, that the balance of the body is in such a way that the right side and the left side must be equal. But when you find one doesn't equal, you find even the occlusion of the teeth, it's not uniform. There's a canting, what we call the canting. When you look at the eyes, because of that also, that they're not in the same line, there's also canting of those particular eyes. What is so significant in this case, that look, in major centers of the world, they will have been fixed at another age. So that, but when you find in the area where you are in here, because they require a lot of reconstructive surgery, and the cost of treatment, is quite very high. This particular Wanjiru will have multiple surgeries, procedures that are done not at once because of too many other things, because you see, and each of them might range from between 6 to 8 hours operations, where first one will involve where we'll open that area and we'll be able to borrow bone from one part of the body, either from the ribs or from the hip, and bring it here. This is what we call the autogenous bone graft, which we bring in. In the Western world, sometimes you could, if you had implants, but you see implants don't have tissue on it, so we always prefer to use its own tissues, and whereby we do the surgery on the face, then we go down and do the surgery on the hip or on the chest, where we remove the ribs and be able to reconstruct that sarcoma, the mandible, and create for a situation which is quite all right. Now, the other thing that we need to look at very critically is that thereafter, see, because the gene is divided towards one side, the maxilla and the mandible, they are not in proper relationship, then there will be surgery that will be required, specifically for the jaws, where what we call orthodontic surgery, where we bring the tissues together, we could be able to do genoplasty and bring the chin, the normal central areas. And once we have done that, the final aspect of the treatment will also be where we'll now see which areas are division of the bone or soft tissues and do that final reconstruction. When you look at this, actually, this operation, this is just approximating it. it might cost between 3.5 million total to about 4.5 million. Sometimes it's very difficult to estimate because some of the things that we use, like the implants and whatever, they cost quite a lot. And it's not a person you put in the hospital and discharge. You'll have to follow for a long period of time. So, and you know, sometimes when I look at these patients, I wonder what's going to happen because many of them, we have so many of these kind of patients that are lying in the rural areas. They have gone to the hospitals and they have been told nothing can be done. And nothing can be done, actually, it's because if they have the resources, this can be done appropriately. And my appeal is that, look, you know, sometimes think about these people who are suffering and maybe forego something and donate towards their welfare, towards their treatment, everything else. Like now in this particular case, we're looking in total to be about 3.5 to 4.5 million shillings. I don't know. I'm just getting that. Despite the fact that we will also be able to volunteer and give our time free of charge for these purposes. But from the experience I've got, you know, it becomes quite very expensive. And you know, we can't do it in any hospital as such. We have to do it in a where we work very high scale, I mean, both in terms of the team that's going to work with us and make sure that things are done appropriately. And one thing that I have to reassure Wanjiru is that definitely doesn't know how long it will take. We'll definitely be able to help her so that she can also begin walking around. Very happy that she has been helped. Because when I looked at some of the videos that she did, the tears that were running her ears, that look, I mean, why is it? Because it draws attention to everybody. They look at her, look what's happening with particular. And you know, that's nature for us. With empathy, so rather than saying, oh, what's the problem, can we come forward and help? And sometimes I'll ask people that, look, why is it that, you know, it doesn't touch you when actually someone is asking on this, unless it's on you? And it gives you more reason why you should be able to go forward and help someone who you didn't even know about. Just for us when to bring this patient to you, do you ever know that the people behind who actually go and look for them, particularly the Save Our Life community, I mean, they go and look for these people and take their time and effort. They come then and ask us. We are showing to a lot of us, look for how can we help them. Particularly with the technical people, we do that. I mean, that alone, that sacrifices so much. And sometimes I wonder why people don't see that, look, this is something that's unique. So ask yourself today, what am I going to do? How can I help? How can I move forward? How can you? I mean, your donation, we don't even need it actually. We would like you to pay directly to the hospital where we're doing these things. That's so long as we have these kids, it becomes far much easier. So please look at this child, Wanjiru Esther, and see what we can do for her. And also remember, before her and in front of her, there are many others of this kind of nature who need this kind of help. If we all join the hand, it will be very nice. You know, sometimes when I see the money that's spent in other things, you know, ask yourself, it will be so beneficial that you're actually having someone in the future who might be able to help you also. Thank you so much. We hope that this will be good.